Do you believe that menopause is something that happens only in your 50s? The truth is, for many women, perimenopause can begin much earlier, also in your mid-30s. And when that happens, women often feel confused, scared, or even ashamed. They blame stress, workload, and lifestyle, but rarely consider that their hormones might be changing. I am Dr. Swadha. As a gynecologist and fertility specialist, I see this worry every week. Whether it is a young professional in Nagpur or a woman in her late 30s flying in from Abu Dhabi, sitting across from me with the same question. Doctor, am I too young for this? Today, I will walk you through what perimenopause is, the early signs that you should not ignore, the myths versus reality, and when you should see a doctor so you feel clear, confident, and not alone in this journey. So what is perimenopause? Menopause is when your periods stop completely for 12 months. Perimenopause is the transition phase before that, when your hormones fluctuate and your body shows early signs of change. In India, the average age of menopause is 46 to 47 years, but perimenopause can begin even 10 years earlier, in your mid-30s. I recently had a patient from Singapore, 36 years old. She was shocked when we told her that she is in her early perimenopause. She said, "Doctor, I thought this happens only to my mother's generation." And that is a common misconception. Early signs. Here are the early signs which I ask women to look for. Irregular cycles, shorter, longer, or skipped altogether. Mood swings and anxiety. Feeling unusually irritable, low, or restless. Sleep changes. Waking up often at night or feeling exhausted despite sleeping. Hot flushes and night sweats. Sudden waves of heat, often disrupting sleep. Weight gain and fatigue, even without major lifestyle changes. And fertility changes. Difficulty in conceiving despite trying. Now, any one of these can happen for some other reasons too. But when they start appearing together consistently for months, then that is a strong signal. A patient from Mumbai once told me, "Doctor, I just thought I was stressed at work, but now I realize my body was asking for help." That realization itself is powerful. Myths versus realities. Let's clear up some myths I often hear. First, perimenopause happens only after the age of 45, whereas the reality is it can begin as early as 35, especially with genetics, stress, and some health conditions. Myth 2. Perimenopause happens suddenly, while the fact is it is a gradual transition which can last over years. Myth 3. Perimenopause only affects your periods. No, it affects your whole body, sleep, mood, metabolism, bones, and even your heart health. The big takeaway. Perimenopause is not just about your cycles. It's about your overall health. And that is why early awareness makes such difference. Now, when to see a doctor? You should see a doctor if your cycles are changing significantly, very irregular, skipped, or very heavy. Mood changes or anxiety are disrupting your daily life. Sleep is consistently poor. You are trying for pregnancy, but your cycles are unpredictable. Or even if you simply want to understand your body better. Sometimes these are perimenopause, but sometimes they are thyroid, PCOS, or anemia. And that is why proper evaluation matters. Tests like hormonal profile, thyroid check, iron levels gives us clarity. And here in Nagpur, India's centrally located medical hub, we see women not only from Maharashtra, but also from cities like Dubai, Doha, Nairobi, who travel for affordable and world-class fertility care. So remember, seeking help early is not weakness, it is wisdom. Perimenopause is not the end of your journey. It is just a new chapter. Yes, it can be unsettling, but with awareness, lifestyle changes, and medications, you can move through it confidently. If you are in your 30s and worried, or in your 40s noticing changes, you are not alone. Women across India, Middle East, Africa, and beyond are navigating this and thriving with the right guidance. If this video gave you clarity, share it with someone who needs this reassurance, and subscribe for more honest and simple women's health guidance. This is Dr. Swadha, and I am here to walk with you one step at a time.